1800s, the German scientist Paul Ehrlich described an ideal drug as a magic bullet. Such a drug would be aimed precisely at a disease site and would not harm healthy tissues. Although many new drugs are aimed more accurately than their predecessors, none of them, as of yet, hit the target precisely. Most drugs produce several effects, but usually only one effect, the therapeutic effect, is wanted for the treatment of a disease. The other effects may be regarded as unwanted, whether they are intrinsically harmful or not. For example, certain antihistamines cause drowsiness as well as control the symptoms of allergies. When an over-the-counter sleep aid containing an antihistamine is taken, drowsiness is considered a therapeutic effect. But when an antihistamine is taken to control allergy symptoms during the daytime, drowsiness is considered an annoying, unwanted effect. Most people, including healthcare practitioners, refer to unwanted effects as side effects. Another term used is adverse drug event. However, the term adverse drug reaction is technically more appropriate for drug effects that are unwanted, unpleasant, noxious, or potentially harmful. Not surprisingly, adverse drug reactions are common. Most adverse drug reactions are relatively mild, and many disappear when the drug is stopped or the dose is changed. Some gradually subside as the body adjusts to the drug. Other adverse drug reactions are more serious and last longer. Between 3% and 7% of hospital admissions in the United States are estimated to be for treatment of adverse drug reactions. Each time a person is hospitalized, the risk of having at least one adverse drug reaction is 10 to 20%. Digestive disturbances, loss of appetite, nausea, a bloating sensation, constipation, and diarrhea are particularly common adverse drug reactions because most drugs are taken by mouth and pass through the digestive tract. However, almost any organ system can be affected. In older people, the brain commonly is affected, often resulting in drowsiness and confusion. Many adverse drug reactions represent an exaggeration of the drug's therapeutic effects, called type 1 or overdose reactions. For example, a person taking a drug to reduce high blood pressure may feel dizzy or lightheaded if the drug reduces blood pressure too much. A person with diabetes may develop weakness, sweating, nausea, and palpitations if insulin or an oral anti-diabetic drug reduces the blood sugar level too much. This type of adverse drug reaction is usually predictable, but sometimes unavoidable. It may occur if a drug dose is too high, if the person is unusually sensitive to the drug, or if another drug slows the metabolism of the first drug and thus increases its level to the blood type 1 reactions, which are usually not serious but are relatively common. Some adverse drug reactions result from mechanisms that are not currently understood, called type 2 or idiosyncratic reactions. This type of adverse drug reaction is largely predictable. Examples of such adverse drug reactions include skin rashes, jaundice, anemia, a decrease in the white blood cell count, kidney damage, and nerve injury that may impair vision or hearing. These reactions tend to be more serious, but typically occur in a very small number of people. Such people may be allergic or hypersensitive to the drug because of genetic differences in the way their body metabolizes or responds to drugs. Some adverse drug reactions are not related to the drug's therapeutic effect, but are usually predictable because the mechanisms involved are largely understood. For example, Stomach irritation and bleeding often occur in people who regularly used aspirin or other non-steroidal anti-inflammatory drugs. The reaction is that these drugs reduce the production of prostaglandins, which help protect the digestive tract from stomach acid. There is no universal scale for describing or measuring the severity of an adverse drug reaction. Assessment is largely substantive. Reactions can be described as mild, moderate, or severe. Reactions usually described as mild and or minor significant include digestive disturbances, headaches, fatigue, vague muscle aches, malaise, in general feeling of illness or discomfort, and changes in sleep patterns. However, such reactions can be very distressful to people who experience them as a result. People may be less willing to take their drug as instructed, and the goals of treatment may not be achieved. What was it?
That was good. Mr. Klein, I'm going to leave a little bit early to go to this party
Sure.
tonight. Can I get maybe one or two more?
Yeah.
You guys mind?
Yeah.